neurological assessment. It was every exam you always start with, you make sure your hands are clean, that your lighting is good, and that you have everything you need to complete your exam properly. I do have all my supplies ready, and my patient is waiting to get started. So with that, I'm going to introduce myself. Hi, Ellen. Hi, my name is Carolyn. I'm going to be the nurse taking care of you today. I wanted to do my musculoskeletal exam and my neurological exam. We're going to start off by doing essentially the musculoskeletal part of the exam and then working into the neurological exam. With that said, we'll start with our hands. We'll work our way up to our arms, then her shoulders, her neck, her spine, her hips, her knees, and her feet and ankles. So we'll start with your hands, Ellen. The way we assess, with any exam, you're going to start with inspection. And with the beginning of all of these, you're going to assess by looking. You're going to be looking for lumps, bumps, nodules, redness, tenderness, asymmetry, those type of things. So we'll start with your hands, Ellen. I want you to simply go through some motions with me to make sure that you have good range of motion. So I want you to flex and then extend. And then with your fingers, you're going to abduct and then adduct. And then for your hands, your wrists, you're going to abduct, and then adduct. Adduction is bringing it towards the body. And that's pretty much the range of motion with her hands and wrists. So then we'll move our way on up the body to her arms. And again, we're going to flex and extend. And then hold your hands out, Ellen. And this is pronation and supination. And with that, you just want to see the nice steady movement, equal symmetry on both sides as she goes through those range of motion exercises. Then we'll move ourselves on up to her shoulders. And the shoulder is a little bit more complicated. The hip muscle, or the hip joint and the shoulder joint is a little more complicated, where you have a little bit more as far as testing for range of motion. So with that, it might be easier if you stand up on this one, Ellen, to give yourself a little more room. But with your arms, you want to flex and extend as far back as you can, and then bring your arms back to your side. And then abduction and adduction. So abduction, of course, is away. And then for adduction, you actually go across your shoulder. And then again with your other arm. And then I'm going to have you lift your arms. This is testing internal rotation and external rotation. Bring both arms up back behind your arm. Perfect. And then bring your arms back down to your side. And then bring them back up towards your scapula. Oh, that's perfect, Ellen. Okay. Back down to your side. That's good. So that's range of motion for her shoulders. And again, you want to watch and make sure you do both sides. You may not be able to do both sides at the same time, but if you can, that does help you as far as looking at symmetry of movement. Then I'm going to do her neck. So Ellen, with your neck, I'm going to have you flex and then extend. And then the easiest way is to just have her do a circle rotation of her neck. And that completes the neck range of motion exercise. Then we'll move into her spine. I'm going to have you face below, Ellen. Move your hair a little bit. So with the spinal exam, again, I'm going to have you bend over and touch your toes. And I'm going to turn you just this way if you'll see if we're still. Excuse me. I'm going to have you bend over and touch your toes, Ellen. And as she does that, she has good. And then come back up, Ellen, and extend backwards. Good. And then twist to the right and twist to the left. And then lateral movement. So then bend to the right and bend to the left. That's perfect range of motion for spine. I'm going to have you turn around so we can look at your spine again. I'm going to go ahead and show you how you would check her spine a little bit more in detail. So again, you would start with inspection. I'm going to have you bend just slightly, not all the way over. But when they're bending over, you want to actually check for kyphosis or scoliosis. You also want to look at her spine, and up here in the cervical area, it should be slightly concave. And then as you get past the cervical area and into the thoracic region, it's going to be a little more convex. And then as you get down here towards the lumbar region, that's again going to be concave. So essentially you're looking for a nice S-curve. And you would feel her spine all the way down, and you would palpate for a complete exam, and again be feeling for any lumps, bumps, nodules, those types of things. Have you stand back up, Ellen? That's perfect. Now, if you can hop back up on the table. And that is essentially the range of motion for her spine. I'm going to have you actually, we're going to move on to her hips. I'm going to have you lay down on the table for that. And so with this, Ellen, I'm going to have you lift this leg up just straight. That's flexion. And then if you don't mind, I'm going to have you flip on your belly. And then lift this leg for me as high as you can. That's extension. If you'll roll back over facing the wall and lay on your side. And then for abduction and abduction, I'm going to have you lift your leg. This is abduction. And then this is adduction, bringing it to you. Now I'm going to have you roll back to your back again. Thank you. And then flex your knee here. And then with the hip, again, it's like the shoulder muscle. It's like the shoulder muscle. So you want to do internal rotation and external rotation. And you simply do this by rolling this in like that, and then rolling it out like that. And she has good range of motion. You would do this with both legs. And again, look for symmetry, assess for pain with movement, or as she's doing those range of motion exercises. Okay, I'm going to have you straighten your leg, Ellen. So then you can set back up for me. Thank you. Then we'll move on down to the range of motion for her knees. So essentially, I might have you stand up, I think, for this one. Extension. Extension, bending. So extension and then flexion. Yeah. And then abduction, swinging it out. And you might be able to do it on the table. If you sit on the table, we can see it maybe a little bit better. Okay. And then just kind of swing it out and then in. And that's abduction and abduction. Perfect. And again, you would do that with both knees. Then we move on down to her feet and ankles. And then, so I'm going to have you flex your feet, extend your feet, abduct your feet, and abduct your feet. And then I just want you to do a simple twisting, circling motion, which proves she has good range of motion with her feet. That completes the range of motion exercises from head to toe. The next thing is I'm going to actually assess her pulses. So what I would do is I would assess her radial pulse, her brachial pulse, radial pulse, and brachial pulse. And those are both strong and equal bilaterally. Move down. The next thing that you would do actually is then move on down to assess her pulses in her lower extremities. The popliteal pulse, you would actually feel if you came on both sides of the knee and met in the middle. That's her popliteal. Her pedal pulse, be on top of her foot, and then her tibial pulse, the side of her ankle. You would assess those, both sides, make sure that they were equal and strong. When you're assessing the lower extremities, you want to look for symmetry, you want to watch for hair distribution, you want to watch for varicose veins. If you have, especially in a male, if there's poor hair distribution in the lower extremities, that's a sign of poor peripheral blood flow, and that can be concerning. That completes the pulse part of that. So then we'll move on to part of the neurological exam. The one thing that I assessed when Ellen was walking in is you would assess her gait. So Ellen, I am going to have you just stand up just to show the people that are watching, and just kind of walk across the room and back. And I know you can't really see this, but essentially you're watching her gait and making sure that she doesn't have any jerking, that she has good symmetry, and no limping. So her gait is excellent. I'm going to have you do a deep knee bend, just squat. And she's able to do that, and she has good strength and good coordination when she does that. Let me sit back down, Ellen. When we get into the neurological part of the exam, there's so many things that are involved in the neurological exam. But for this part of the assessment, we're going to talk about coordination and skills movement. And there's different tests that you can do. There's a finger to nose test, a heel down the opposite shin test, and rapid alternating movements. I'm going to start with the rapid alternating movements. So Ellen, what I'm going to have you do is, with your hands down like this, slap your thighs, and then turn them over and slap your thighs. And then I want you to do that again, same order, and do that as quickly as you can. Perfect. Okay, so as you can see, she can do that swiftly and quickly with good coordination. If she had a head injury, a brainstem injury, she would not be able to do that and have good coordinated movement. The next test, again, is called the finger to nose test. So what I do is I hold my finger in different positions. I have her touch it with her finger and then touch her nose. So I want you to touch my finger and then touch your nose. And so you can see how she follows that easily and quickly. Again, if she was a stroke patient or she had a brainstem injury or a head injury, she wouldn't be able to do that swiftly and quickly with nice steady movement. The other thing, and I think they can see this, let's see, is essentially you take the opposite heel and you run it down the shin of your opposite leg. And you do that nice and steady and even. And she does that. Perfect. She's that good. Okay, the next part is then, and that kind of is the coordination skills movement. The next is sensations. Most of the time when you're assessing sensations, you do that with the patient's eyes closed. So I will tell her to close her eyes, but we will, okay, thank you. So what I'm going to start with is just a simple Q-tip. And I'm going to have her close her eyes, and I'm going to have her just say now, or tell me when she can feel me touching different parts of her body. Now. 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 Okay, perfect. So as I went through that, with this Q-tip, I touched her cheek, I touched her arms and her hand, and I touched the top of her foot. And she was able to feel that soft sensation. Another test is called stereognosis, and that is a test where you actually put a familiar object in their hand, and they are able to recall that. The reason that is like an important test is because, like with a person with a test, you may put that object in their hand, but they can't recall what that object is. So it's, it's simple everyday objects that they can recall. So Ellen, I'm going to have you close your eyes and put something in your hand. Can you tell me what that is? Paperclip. Perfect. Again, that's stereognosis. Another test that we do is where they're able to recall, you essentially make a letter with your finger inside their hand, or a letter or a number, and they're able to tell you what that is with their eyes closed. Close your eyes. A6. Good. Okay. Again, that's a sensation test. Another way of doing sensation is I have this Q-tip, or not a Q-tip, but I have this paper clip that's kind of, I have broke open. You could use this, you could use a tuning fork. And a person, like, let's say, that has peripheral vascular disease or maybe has diabetes, and they don't have good sensations in their extremities, they're not going to be able to differentiate, the feels. So sometimes the wider the part they go, the farther down the body you go, it may have to get wider and wider before they can actually feel 2 pokes versus 1. So now I'm going to have you close your eyes again. And just tell me, 1 or 2?
2. 1.
Eyes closed.
2. 1. 1.
And she was able to identify all those very easily. But like once again, if they were having problems, they may not be able to do that. The next thing is we need to elicit deep tendon reflexes. So we're going to check her brachial radialis, her patellar, and her Achilles. And Ellen, I'm actually going to have you slip your shoes and socks off for this part. Thank you. So, let's see. One way you can do this is I'm going to hold your arm up. You just let it drop. This is the brachial radialis reflex. And I don't know if you were able to see that, but she did have a good, strong reflex there. So then I'm going to move down to her patellar. And you actually feel her kneecap, and it's right below that. Good. And she has good bilateral reflexes. And I will move on down. That's good. I can hold it.
Yeah, they can.
I can hold it up. And then, of course, good. Good. So her reflexes are good bilaterally, equally, and 2+. The next thing I'm going to have you do is the Babinski reflex. You should not have a positive Babinski reflex in an adult or anybody over the age of 2. Babinski reflex is normal in infants up to the age of 2. What I should see is plantar flexion when I stroke the bottom of her foot. Gotta get something. Relax, Ellen. Okay. So you should see plantar flexion with that. That concludes the reflex part of my testing. And essentially the end of the neurological exam. There's a couple more tests that I want to do. I need to do my muscle strength testing on all the large muscle groups and my Romberg test. So, Ellen, I'm going to have you, the Romberg, yeah, I'm going to put your shoes on top on, that'd be great. Okay. So with the Romberg test, I'm just going to have you hop up, feet together, arms down to your side, and then arms up, pronation up. Keep your legs together and close your eyes. So with that, she does that, and you have her hold that position for about 20 seconds. They should be able to hold that position for 20 seconds without much swaying, falling down, losing her balance. She would have a positive Romberg bird test if she fell or she wasn't able to maintain that positioning. Okay, that's perfect, Ellen. Thank you. Hop back up on the table and we'll do our strength testing. So again, I'm going to start with all the major muscle areas, but with her hands. So what you do with all the range of motions, essentially what you do is you provide resistance to each area that we did earlier with range of motion to see if she has good strength. Okay, so let's start with your hands, Owen. I'm going to have you flex it, and I'm going to try to push them together. And then I'm going to try to, perfect. And then I'm going to have you try to push again, like abduct away, just like this. And then towards me. Perfect. Excellent. And then squeeze my fingers. Perfect. That's good. And then we'll move up to her arms. So let's flex your arms. And then try to keep me from letting you flex. Perfect. And then push against me. Good. And then with your shoulders, I'm going to have you raise them high. You can do just do one arm if you want out here. But I'm going to try to place resistance. And you just go on up. Good. And then down against me. Good. And then out. And then in. Good. She has good strength there, and you would do that bilaterally on both sides. And then I'm going to have you lay down for your hips and your knees. Now I'm going to have you flex up and then against me. Excellent. Bend your knee. I'm going to push against me and then out towards me. Perfect. Have you step back up. And again, going to have you push against me and back against me, out beside me, and out towards me. Perfect. And then with your feet, I'm going to have you, see if you can see this, up towards your body, push, and then push me away, push out towards me, and then in. And that concludes the muscle strength testing, and it actually concludes my exam. I think that concludes everything, and thank you very much.